Hello everyone, we are from Group J who would like to present acute laryngitis today. Our group mates are Anwar, Sangeeta, Noor Atira and Shamina, and our group supervisor is Dr. Farah Liana. These are the contents of our montage video. So, what is acute laryngitis? It is inflammation of vocal fold mucosa and larynx that lasts for less than 3 weeks. How is it different from chronic laryngitis? Chronic laryngitis is inflammation of vocal fold mucosa and larynx for more than 3 weeks.
The etiology of acute laryngitis can be divided into two, infectious and non-infectious. The infectious type is more common and usually follows upper respiratory infection. Exanthemus fevers like measles, chickenpox, and whooping cough are also associated with laryngitis. The non-infectious type is due to vocal abuse, allergy, thermal or chemical burns to larynx due to inhalation or ingestion of various substances, or laryngeal trauma such as endotracheal intubation.
What are the signs and symptoms of acute laryngitis? Throat pain. Throat pain or a feeling of discomfort in the throat is a common presentation in patients. In many patients, this pain is particularly worse after talking. Hoarseness. Patients with laryngitis will have an inflamed larynx which will affect the vocal cords, producing hoarseness of voice. This results in their voices sounding raspy, strained, or lower in pitch. In more advanced cases, this will lead to a complete loss of voice. Cough. In laryngitis, patients usually present with a dry, irritating cough that is usually worse at night. Symptoms such as fever, malaise, and dryness of the mouth and throat may present if laryngitis follows an infection of the upper respiratory tract. Laryngeal appearances vary with the severity of disease. In early stages, there is erythema and oedema of the epiglottis, airy epiglottic folds, arytenoids, and ventricular bands. But the vocal cords appear white and near normal and stand out in contrast to the surrounding mucosa, betraying the degree of hoarseness the patient has. Later, hyperemia and swelling increase. Vocal cords also become red and swollen. The subglottic region also gets involved. Sticky secretions are seen between the cords and the interarytenoid region. On the left, we have a normal laryngoscope which is labeled. On the right, we have a generalized hyperemia of the vocal fold epithelium, with edema of the superficial layers giving the appearance of swollen cords.
Next is the management of acute laryngitis. First is vocal rest. This is the most important single factor. The use of voice during acute laryngitis may lead to incomplete or delayed recovery. Second is voice hygiene. Third is avoidance, which is avoidance of smoking and also alcohol. Fourth is steam inhalation. It is done to soothe and loosen the viscid secretion. Fifth is cough sedative. It is to suppress troublesome and irritating cough. Next is antibiotics. This is given when there is secondary bacterial infection. And lastly is analgesic. It is given to relieve local pain and also discomfort. What is voice hygiene? Voice hygiene is a term used to describe habits which support a healthy and strong voice throughout your life. A good voice hygiene consists of increased consumption of fluid, which is aim for a minimum 8 glasses of water per day. Rest your voice, use proper amplification and breath support. Do not talk fast or push words out with strain so that you can finish entire thoughts in one breath. Refrain yourself from yelling and whispering. Warm up your voice, especially when you are a singer. Minimize irritant, avoid smoking, alcohol, and going to any irritating environment. And lastly, minimize clearing the throat. Increased throat clearing makes vocal folds more susceptible to bruising and irritation. It also can cause pain and affect the voice.
Take-home messages. Acute laryngitis is defined as an inflammation of the vocal fold mucosa and larynx that lasts for a period of less than 3 weeks and can be due to a host of infectious and non-infectious etiologies. The signs and symptoms of acute laryngitis are cough, hoarseness of voice and throat pain, as well as infectious symptoms such as fever. Changes in laryngeal appearance also become apparent as the disease progresses. Management for patients varies from patient to patient and may include avoidance of triggers, antibiotics and analgesics, and voice rest and vocal hygiene. And finally, vocal hygiene is very important in maintaining a healthy and strong voice and includes a few easy steps such as increasing consumption of fluid and refraining from yelling, among other steps.